My name's Hilary and I'm the clinic manager here at Visual A's in Bolton. I've been here since the clinic opened in 2001, and during that period of time I've seen literally thousands of people come through and experience the benefits that having laser eye treatment can give them. And I'd have to say the very best part of my job is seeing the reactions from people once they've had it done, whether it's straight after the surgery, day one post-op, a week, a month, a year down the line. It really makes the job very, very worthwhile. So what are the first steps if you're considering having laser eye treatment? Obviously, first and foremost, you need to ring and make an appointment and get yourself booked in for an assessment and consultation. The assessment and consultation is completely free of charge. Take about an hour of your time, and there's absolutely no obligation whatsoever for you to make any decisions there and then. But for a lot of people who are considering laser eye surgery, first and foremost you need to know, am I suitable? Can I have it done? So I would always say, if it's there, if you're thinking about it, is it for me? Am I suitable? Can I have it done? Come and have the appointment, because that way you'll be able to talk to us. Most importantly, talk to your doctor who's going to do the treatment, put any questions that you've got to him, get your answers, and then you'll be able to go away and make an informed decision whether it's for you or not. So if you're thinking about it, give us a call or go on the website and get in touch. To find out if you're suitable for laser surgery, initially you need to come and have an assessment. Now, if you're between the ages of 18 and 70, potentially you are suitable for laser surgery. It's always a good idea to have a copy of your last eye test with you when you come, because that gives us a very good benchmark, so that when we test your eyes we've got something to compare against to see whether your prescription is indeed stable, because having a stable prescription is a very good thing to determine your suitability. So you would come for an assessment. Bear in mind, if you wear contact lenses, you can't wear your contact lenses for a few days. If you're unsure about the length of time you can't wear them for, give us a call at the clinic or ask one of the members of staff in the practice. But basically the assessment feels, to all intents and purposes, just like an eye test. The optician will test your eyes, check your prescription, take some measurements to do with the health and the anatomy of your eyes, and once all that information has been gathered, you'll then go through and see the doctor for your consultation. The consultation that you'd have here at Visual A's is always conducted by the doctor himself, who would ultimately go on to do your treatment. That's the way we started in 2001 when we opened, and it's still the way we do it today. There really is no replacement for that one-to-one chair time between the doctor and the patient. That one-to-one chair time with the actual doctor who's going to do your treatment is absolutely invaluable to the patient. It's so nice and reassuring to meet the doctor, ask any questions that you've got, get those answers straight from him. And of course, if you are suitable and you do decide to go ahead for treatment, when it comes to that day of treatment, you've already met the gentleman who's going to be performing the surgery, which means the patient is much more relaxed, and it's just generally a much nicer experience for you on the day. Yes, both eyes can be lasered at the same time, and in fact it's common practice that we laser both eyes at the same time. Of course we always do one eye and then the other eye, they're not both lasered simultaneously. But you can talk to your doctor about this. We have had situations where patients have specifically asked to have one done at a time, but really that makes it more uncomfortable post-operatively because you've got one eye corrected and one eye not. So we would usually recommend that all patients have both eyes treated together at the same appointment. Here at Visual A's, we've treated a lot of local people from the Bolton and the surrounding area, and we treat an awful lot of patients that come on recommendations. So we treat lots of family members and friends, and it really is a great accolade for the clinic that so many people do come to us on a recommendation because they feel that they've had really great service, they've been really well looked after, and most importantly, they're really happy with the end result and the quality of the new eyesight. So because of this, we set up our patient referral scheme. So if a patient comes for treatment and they know someone who's already had their eyes lasered here, that person will get a discount off the cost of the treatment, and the person who's recommended them will get a little referral voucher from us as well. It's just our way of saying thank you for spreading the word. Here at Visualise, we offer a wide range of payment options to make your laser treatment more affordable. From interest-free credit to a longer period which is interest-bearing, we can make your laser eye correction affordable. For more information, have a look on the payment plan page on our website or ask any of the team in clinic.